Plus a staggering number of COVID-19 cases reported statewide, the highest number since December of last year. We begin midday with an update on the battle against COVID-19 in our state. State Health Officer Dr. Thomas Dobbs tweeting just hours ago, "Very sad indeed. Didn't have to be this way. Fourth wave is here." That in response to the State Department of Health releasing the latest number of confirmed COVID cases statewide at 2,326. That is the highest weekend total dating back to December 21st. Now, these cases are a 3-day total reported to the state health officials over the weekend. 20% are in South Mississippi. Joining us now with her insight into what's being seen in South Mississippi is Singing River Health System Chief Nursing Officer Susan Russell. Hi, Susan. Thanks so much for joining us.
Thank you for having me, Chet.
All right, let's get right to it. 2,326 cases statewide, and our state health officer, Dr. Thomas Dobbs, tweeting that it was all avoidable. Are you of the same belief?
I pretty much subscribe to the same beliefs he does. We do have a couple of patients that have been fully vaccinated that got the COVID virus, but 95% of the people who are suffering from COVID right now in our walls are the ones that have been unvaccinated.
So many right now are talking about how bad the Delta variant is in the state. However, with a look at the latest numbers from the State Department of Health, statewide Delta only accounts for 23% of variant cases, or 231, and the Alpha variant accounts for 69%, or 698 cases. So do you know why the conversation is surrounding Delta when, according to these numbers, Alpha seems to be the dominant variant in Mississippi?
I think a lot of the conversation's always around the latest variants. We've gone through different types of variants throughout this outbreak, including the one from the UK, the one from South Africa, and now we're talking about Alpha, Delta, and all the other ones. But at the end of the day, we're still talking about the same primary virus, which is COVID. And the vaccinations work on all of the variants that we're seeing right now. So that's the most important to have as a takeaway.
So nothing based on the variant, nothing different that we should do like COVID?
We should treat it all primarily as COVID. We're almost a year and a half into this, and we know what works and what doesn't work. What we have found, vaccines work. They work. They're safe. They're effective. Are they 100% side effect proof? No, I can't tell you a Tylenol won't have side effects. What we're finding is risk versus the benefit. Definitely, you are safer and more likely to live if you have the vaccines. Other things, I know that we have moved away from masking in most situations other than us in healthcare who are required by the CDC to wear a mask. I'm starting to see that a lot of other places are starting to reconsider mask mandates, just because we know it cuts down on the transmission of viruses. And the less virus you're exposed to, the less likely you are to get COVID. So, what I'm telling people, the things we know during this outbreak, hand washing, definitely masking, and most definitely vaccines are proven to kick this virus and has caused the rates to go down. What has happened in the last month is that we've gotten a little loose on our being around each other, no social distancing. People have quit wearing masks. And of course, 4th of July holiday where everybody got together and barbecued. We saw an escalation last year after the 4th of July, and we're definitely seeing it this year after the 4th of July.
You kind of answered my next question. So I was going to ask if you believed that elected officials should consider rolling back guidelines, but do you think those guidelines would work more effectively than more vaccinations, or do you think they're about the same?
I think the vaccinations are far and away the biggest tool in our arsenal that we have to cut down on the transmission of this vaccine, period.
Singing River Health System.
Help.
Oh, go ahead, sorry.
Go ahead, I'm sorry.
You were saying masks help?
Masks help with any virus, whether it's a flu virus, whether it's a cold virus. And yes, COVID is a virus, so wearing masks does cut down on the transmission. At the end of the day, it does not provide immunity to your body, which is what the vaccination does. That means you're carrying around that protection every second of every day, and that's invaluable.